Yeah, you can sit right
Good
there.
evening, everyone. I would like to welcome you to the National Fragile X Foundation webinar, Fragile X
No, it's right here.
Carriers in Health, presented tonight by Dr. Randi Hagerman, who, among other things, is the
Put,
founder of the
okay.
National Fragile X Foundation. I'm Jane Dixon Weber, the Director of Education and Support Services here at the Foundation. Before I introduce our speaker tonight, I want to tell you that these webinars are provided by the National Fragile X Foundation for free, thanks to the support of our generous donors. You can help continue making these resources for other families by giving to the foundation at donate.fragilex.org. A couple housekeeping issues. So Dr. Hagerman has a few slides we're going to go through tonight first, and then we'll use the chat box on the side for questions, and also use the chat box if you have any problems. We have received a few questions in advance, different areas of concern, and I have grouped those into topics, and Dr. Hagerman will be addressing those tonight. Now, I would like to introduce Dr. Randi Hagerman. Dr. Hagerman is the medical director of the UC Davis Mind Institute and the director of the Fragile X Research and Treatment Center. She has more than 20 years of experience in the field of neurodevelopmental disorders and is an internationally respected leader in Fragile X research, including Fragile X syndrome. As we know, the genetic condition that's the leading cause of inherited intellectual disability and the leading single gene cause of autism. Dr. Hagerman has written more than 300 peer-reviewed articles and numerous book chapters on neurodevelopmental disorders and has written several books on Fragile X. You all know I could go on, but welcome, Dr. Hagerman.
Thank you, Jane. It's a pleasure to be here, and I'm glad there's such a wonderful turnout for this webinar. I think the people on the webinar can see the slides. I just want to go through a few basic slides that'll cover some of the molecular mechanisms and the spectrum of involvement we can see in premutation disorders. I'm from the Mind Institute, and here's a little picture of the Mind Institute. There's many people on our Fragile X team, including other PIs or investigators, primary investigators, including Dr. David Hessel, Dr. Susan Rivera, Dr. Len Abadudo, Dr. Andrea Schneider, and many staff and professionals who work with us. So I'm just going to try to change. Yeah, here's a slide that just points out the difference between the premutation and the full mutation. I think most people will be able to see my pointer. In the premutation area, in this yellow area, represents the CGG repeat, which is between 55 to 200 CGG repeats. So more than we see in typical individuals without a Fragile X mutation, but less than what we see in the full mutation. And the full mutation involves more than 200 CGG repeats. And when that occurs, there's usually methylation of the gene, so there's little or no messenger RNA produced. So in premutation carriers, there is an increase in messenger RNA that can be anywhere from 1.5 to 8 times normal. And it really is this excess messenger RNA which can cause some of what we call RNA toxicity, leading to some of the clinical problems that we'll talk about. I want to point out that the premutation is much more common than the full mutation, but it varies from country to country. So in females, anywhere between 1 and sometimes some of the reports are even close to 1 in 100, such as in Mallorca or in Colombia, and other places go up to about 1 in 250 females. And in males, it ranges from 1 in 250, I think that lowest number was in Spain, to 1 in 810, and that was in Quebec, Canada. So they're far more common than individuals with the full mutation, which also varies by country, But if you think about 1 in 4,000 to 1 in 5,000, except for countries where it's much more common, like in Colombia, in South America, that's a good prevalence figure to think about. So we're going to go through some of the clinical involvement in premutation carriers, and a lot of the questions have to do with a variety of different types of clinical involvement. The problem with Fragile X-associated primary ovarian insufficiency, or FAXPOI, was the first one that was identified. We actually published a paper, a Chronister et al. Paper in 1991 that talked about an increased rate of early menopause, and that's been shown to be true for many, many other research groups. And then the Fragile X-associated tremor ataxia syndrome, or FAXTAS, was first reported in 2001 with about 5 cases that were reported. But there's been subsequently hundreds of papers that have been written on FAXTAS and other types of involvement like depression, anxiety, and a variety of other medical problems that can be associated with the premutation. This is just a pedigree here, which has the CGG repeat number underneath. So the dots in the middle demonstrate carriers. And as most of you know, if you have a grandfather who's a carrier, then all of his daughters will be carriers, but none of his sons, because they will get his Y chromosome. But then the women can go on to have individuals with a full mutation. So if you have a child with a full mutation, the mother is always a carrier, or she may have a full mutation herself, and we have many women who have a normal IQ with a full mutation. But you cannot get a full mutation from a male carrier because the sperm that comes from a male, whether he has a premutation or a full mutation himself, will go back to the premutation when it's passed on. That's why the daughters are only carriers. And then the risk for passing on a full mutation from a woman relates to the number of CGG repeats she has. So the higher the repeat, the greater the risk, and those with a repeat number of over 90 or 100 will pretty much pass on a full mutation 50% of the time when they pass on that mutated X. So 100% for those that get the mutated X will have a full mutation if they have more than 90 or 100 repeats. Now, between 60 and 90, the number of AGG interruptions can have a significant effect on whether the premutation will go to a full mutation in the next generation. So having 2 AGG or 2 interruptions of AGG in the CGG repeat can lower the risk from say a 70% risk for someone that has 80 repeats down to maybe less than 10% with the same number of repeats if they have 2 AGG anchors. So that's an area that's being studied further, and there are some questions that relate to those AGG anchors, and about every 10 CGG repeats will have an AGG anchor in many individuals who are carriers. And so what we see mainly affecting individuals who are adults is FAXTAS typically starts after age 60. Occasionally it can start earlier. Psychiatric problems can occur also in childhood, including anxiety. Anxiety and depression can be seen in about 50% overall of adults, and FAXPOI is seen in about 20%. Let me just go to the next slide here. And the degree of involvement really relates to a number of different factors. Clearly, the CGG repeat number can correlate with some of the clinical involvement, such as the age of onset of FAXTAS. occurs earlier, the higher the CGG repeat number. There's a variety of different types of cellular dysregulation, including mitochondrial function, which can relate to the CGG repeat number. Of course, there can be background gene effects and environmental effects. So many of you might ask, well, what types of environmental effects? Well, for instance, women who are smokers and have the premutation are more likely to have earlier FAXPOI. And that's because cigarettes can lead to enhanced oxidative stress. And we're also interested in other environmental toxins, pesticides, insecticides, high levels of mercury in fish. There's just a variety of toxins that is in the modern day environment, and the work that we're interested in kind of blends with some of the research work that's done in autism, because there may be some environmental toxins that can predispose to autism also. Also, medical problems like seizures are more likely to cause autism or developmental problems, whether you have Fragile X syndrome or even premutation involvement. So that's a medical problem that can lead to a seizure, that could lead to hypoxia, that can worsen neurodevelopmental problems, or you know, aging problems also. So we're very interested in understanding background gene effects and environmental effects, and how that can impact the phenotypic features we see. A very stressful environment is able to cause more problems related to anxiety or depression, and that can actually cause more stress in individuals, and that can lead to more shrinkage of certain parts of the brain, and I'll show you some examples of that. Trauma, being abused by others, either physically or mentally, can be problematic. So we like to treat psychiatric problems like depression or anxiety with antidepressants, also known as SSRI, or selective serotonin reuptake inhibitors, like Prozac or Zoloft. There can be immune dysregulation. That is a particular problem more for women than for men. Hypothyroidism, fibromyalgia. We see about 1 to 2% that can have lupus or multiple sclerosis, either diagnosed or some features of MS. And then we've also reported that MS can occur together with FAXTAS in rare cases. So a variety of neurological problems can occur in the aging, such as a neuropathy or having numbness and tingling, particularly in the lower extremities, or pain in the lower extremities. Also, chronic pain syndromes like fibromyalgia or migraines are more common in premutation carriers. Sleep apnea, particularly that leads to hypoxia or low oxygen levels at night, we think is more common in individuals with FAXTAS, and we think that the hypoxia, somehow my slides jumped. Let me see if I can get back to, maybe David can help to get back to that fourth slide. Yeah, so hypoxia, no, back a couple. The fourth slide would be great. So we actually recommend, yep, that's great. Stay right there. We absolutely recommend sleep apnea studies, you know, looking at the amount of low oxygen at night in individuals, particularly if they have progressive neurological symptoms or FAXTAS. Memory problems and foggy thinking is a very common complaint. It doesn't mean you're going to get FAXTAS, but these are common problems in premutation carriers, and we know that individuals who are older with the premutation, even without FAXTAS, can have memory problems and foggy thinking. But, you know, this is a problem in aging in general. I have memory problems myself, so this is not uncommon. High blood pressure is seen in about 60% of individuals with the premutation, and I think it's more common as you age. We also see erectile dysfunction very commonly in male carriers. It often has an onset a couple years before FACS-TAS. Having erectile dysfunction does not mean you'll get FACS-TAS. And overall, FACS-TAS occurs overall in about 40% of males and in about up to 16% in females, although the numbers can increase as you age. So FACS-TAS is associated with tremor, ataxia. About 50% can have Parkinsonian symptoms. That is a difficulty initiating movement or resting tremor. There can be autonomic dysfunction, sometimes fainting episodes, executive function deficits, problems holding information kind of online in your mind while you're given more information. That becomes, in general, more problematic as you age. And memory and cognitive decline can occur in FACS-TAS, and we see dementia in about 50% of the males, but it's not seen very commonly in females with FACS-TAS. I do believe that females who have FACS-TAS can have mild versions of FACS-TAS and can be very stable, sometimes for a couple of decades, with just mild tremor. Sometimes FACS-TAS can occur with other problems like Parkinson's disease, and then it can also occur together with Alzheimer's disease or even Lewy body dementia. We've seen a couple of cases of that. So if you have more than one disease, then your FACS-TAS can progress more rapidly. Next slide. Okay, that's fine. We can stay on this slide. This just looks at in work having to do with FACS-POI. Stephanie Sherman's group has done excellent work. Also Marcia Matlick, and this is a slide from one of her papers showing that individuals with the premutation who have between 70 to maybe 110 CGG repeats are at highest risk, actually, to have menopause below age 40. And then the risk seems to have a U shape, such as those with a lower number of repeats or those with a much higher number of repeats, particularly over 120, are at lower risk. Of course, these numbers are less common than the numbers between 70 and 110. But there does seem to be a U shape, so there may be something that is occurring in the upper end of the premutation, which is semi-protective from FACS-POI. One of the things we do know is that the FMRP level can drop a little bit when you get in the higher end of the premutation, and perhaps that's protective of some of the RNA toxicity. One of the questions that came in beforehand is that I'm a premutation carrier, but I seem to have some features of Fragile X syndrome. And that is often, you know, things like a long face or prominent ears or hyperextensible finger joints, loose connective tissue. And that's because there can be a slight lowering of FMRP levels, which can make you have some of the physical features of Fragile X. But it's important to remember that the majority of individuals with the premutation have very excellent cognitive abilities. And I have seen so many gifted people with the premutation that I think there's a cognitive enhancement associated with the premutation. So that's a good thing. I think many premutation carriers are very good with educational endeavors, oftentimes, you know, compulsive about getting more education, sometimes driven, and that bodes for success in our society. So there are, I could talk another hour about benefits of having the premutation. The reaction time can be faster. There's a lot of good things that can happen with the premutation. having a premutation is not all bad. And in fact, in human evolution, probably the evolution of better cognitive abilities is tightly related to the expansion of the CGG repeat. Next slide. So one thing that can happen with the premutation is the neurons with the premutation are more vulnerable in a neuronal cell culture. So this slide compares wild-type neurons with premutation neurons. And what we see is the premutation neuron can die more easily, faster than the normal neuron. And we think that this is very key to some of the things we're talking about related to avoiding toxins in our environment, because we think the premutation neuron is more vulnerable to toxins, perhaps because there's some level of mitochondrial dysfunction, some oxidative stress, but we think the neuron is more readily dying in negative circumstances in the environment. And this is important to remember. That's why we tell premutation carriers to stay away from toxins or toxic chemicals or toxic environments. We know that drinking too much alcohol can really progress white matter disease in both those with the premutation and those without. We've seen it progress FACS-TAS. Smoking, we think, is not good. Excessive amounts of illegal drugs or even opioids that can be prescribed by a physician for chronic pain, we think can be associated with progression of neurological symptoms. And again, we only have case reports right now of individuals who are progressed with exposure to some of these toxins, but it definitely is an area of future study, and we think that this all relates to the vulnerability of the premutation neuron. Next slide. Let me see if I can do it. So some of you have probably heard about RNA toxicity and the sequestration of proteins that can happen when you have an expanded CGG repeat. Also Peter Todd and other groups have talked about the production of FMR poly-G because the translation of the message sometimes can start earlier, such that the CGG repeat makes for excessive polyglutamine tail to the FMR1 protein. And this can be also toxic to the neuron. We think that this RAN translation probably occurs only later in FACS-TAS, but there's a lot of research going on now to see how it's associated with the premutation toxicity. And it doesn't occur in those with the full mutation. Next slide. I want to make sure I have time for questions and answers. Cardiac arrhythmias are not uncommon in premutation carriers, particularly bradycardia, and we encountered this initially because we very much want to do an MRI in diagnosing someone with FACS-TAS, but if they have a pacemaker in place, we're not able to do an MRI. And oftentimes the pacemaker is placed because of an arrhythmia or because of bradycardia, which means dramatically slowing down the heart rate. So a premutation carrier, particularly an older carrier that has episodes of fainting or passing out or complains of arrhythmias, they really need to see a cardiologist. And it's not good to faint and pass out because this can impede the blood flow to the brain, particularly if the heart is beating very slowly. And I'll show you that the inclusions in FACS-TAS can occur in other parts of the body, including the cardiac conduction system. So back pain and disc problems is very common in premutation carriers, but also very common in the general population. And many individuals seem to have back surgery, which may not improve the pain, it may make it worse. And we haven't studied this in detail compared to age-matched controls, but I'm wondering if some of the loose connective tissue in carriers can lead to more problems with the spinal column or with a disc protrusion So this needs to be studied further. Foggy thinking and memory problems is something that we hear all the time, and there are some medications that may help with that. Many individuals have had a workup for autoimmune disease, like maybe yes or maybe no with a lupus diagnosis, or the anti-nuclear antibody test sometimes can be positive, which is a blood test that tells you that there might be some antibody production or autoimmune disease, but it can come and go. Many individuals have told me they experience an internal tremor, like they can feel their body reverberate, but you may not see it clinically. We've had several cases of non-epileptic seizures. That means a person has an episode that might look like a seizure or pass out, but when they do an EEG, you can't see spike wave discharges. But sometimes spike wave discharges can occur very deep in the brain, and the non-epileptic seizures may have a different etiology, but we have occasionally seen that in premutation carriers. I have had probably 5 to 10% of women that have had pulmonary fibrosis, which I think is probably more common than the general population, but it needs to be studied. Also myelodysplasia, anemia that doesn't respond to iron, or other types of dysregulated growth in the bone marrow. We've seen several cases of this. That is actually associated with short telomeres, and it can be associated with RNA toxicity, and both of those problems occur in premutation carriers, so that's a current area of research. I'm also interested in anybody with chronic kidney disease or congestive heart failure, because we know that the premutation or FACS-TAS inclusions can occur in those two organs, but usually that's very late stage in life. Next slide. So here's what the inclusions look like. They're eosinophilic intranuclear inclusions, and this is a big neuron here. And this is the nucleus, and here's the inclusion in the nucleus. It is also seen in the astrocytes. It can also be seen in the Purkinje cells, and in other types of glia. But it's not only in the central nervous system, it can also be in other tissues. And next slide will show that. So it's not just in the brain, but it can occur in the peripheral nervous system, in the pancreas, in the adrenal gland, in the thyroid, in the kidney, in the heart, in the conduction system, in sympathetic ganglia. It can also occur in the ganglia. These are groups of neurons that kind of control the heart rate. Also in the intestines, in the myenteric ganglia of the intestines, in the stomach too. Can occur in the ovary. These inclusions can occur in the ovary, and in the Leydig cells in the testicles. And the Leydig cells are the cells that make testosterone, so testosterone can be deficient, and usually is deficient in some of the FACS-TAS men, and maybe even become deficient before FACS-TAS, and it could be related to erectile dysfunction. We don't routinely recommend testosterone replacement because that can increase your risk for prostate cancer, but this is something that you can discuss with your doctor. So this broad distribution of the inclusions of FACS-TAS, which we feel are associated with RNA toxicity, can explain some of the other symptoms that we see, such as constipation in individuals with FACS-TAS, or even irritable bowel symptoms in individuals in midlife. Next slide. So let's see, could we go back one? Or was this back one? I'm not sure which slide comes. All right, let me talk about this one first. This just shows the size of the hippocampus on the right side, and this is a scale for anxiety symptoms within the last week. So the more anxiety you have, whether you have the premutation without FACS-TAS or with FACS-TAS, the smaller your hippocampus. And the hippocampus is a really important part of the brain that's associated with cognitive abilities, including memory. And so it's not good for the hippocampus to get small, because that suggests that you'll have more cognitive dysfunction. So we know from other studies not having to do with the premutation that excessive anxiety and depression can shrink the hippocampus. And we think we're seeing the same thing. This is in females, but I know the hippocampus gets very small in FACS-TAS too. So we're just beginning to study that more. And we want to do things that stimulate the making of new neurons or maintaining the size of the hippocampus and the overall brain in general. We will be talking about treatment. Next slide. Let me see if I can change it. Okay, so treatments for premutation carriers really include these main categories. We like to stimulate neurogenesis of the making of new neurons. And believe it or not, exercise does that. So I try to exercise every day. My husband forces me to get on the treadmill every night after work and watch something, you know, on Netflix or whatever while I'm walking on the treadmill. And I am trying to stimulate neurogenesis because I don't want to lose memory or develop dementia with my aging either. I also think that taking an SSRI or a selective serotonin reuptake inhibitor is good because medications like Prozac and Zoloft stimulate neurogenesis. So if you have depression or anxiety, don't be afraid about taking an SSRI. I think they can be very, very helpful. From my own personal experience, they can be very, very helpful. You also want to reduce oxidative stress. Now, vitamin deficiency, like vitamin D deficiency, can be associated with problems. Folate or B vitamin deficiency. So we like folate, and B12 levels can reduce homocysteine, which is kind of bad, like cholesterol. So you want to reduce it. And it's associated with better aging. Oxidative stress can come from mitochondrial dysfunction, so we do recommend antioxidants. This has not been studied, but a number of individuals have felt much better on antioxidants. I take them. I think that they are part of a good dietary, healthful eating style. Lots of fruits and vegetables, lots of berries, omega-3. We do know that omega-3 can help the knockout mouse improve hippocampal function. And we do know that there's oxidative stress in those with Fragile X syndrome too, but we also know that this occurs in premutation carriers. So some of what I say is true for the general population too. You know, I was taking calcium and vitamin D twice a day. My doctor measured my vitamin D level, and guess what? I was deficient. So even if you think you're on vitamin D, sometimes you're not taking enough. So I up my vitamin D intake to, I vary between 5,000 to 1,000 international units a day because my calcium and vitamin D supplement wasn't enough. We like to eliminate factors that can lead to CNS deterioration. High blood pressure, even mildly to moderately high blood pressure, is not good for the aging brain. And the latest data coming out in the general population says treat even mild high blood pressure. We see a lot of aging carriers who say, oh, I don't have high blood pressure. And when we measure their blood pressure in clinic, it's high. And so you might have thought you didn't have high blood pressure 2 or 3 or 4 years ago, but you need to get it checked on a regular basis by your doctor. We don't like sleep apnea because when you obstruct at night, that can lead to hypoxia at night. And hypoxia can stimulate microglia activation in the brain and cell damage to the brain. So if you have sleep apnea, or if you don't know, it's good to get a sleep study. And if you're hypoxic, go on oxygen or CPAP at night. We like to treat immune dysfunction, so talk to your rheumatologist. There are some immune boosters out. Probiotics is thought to be helpful. I drink echinacea tea every day because I think I don't get sick as frequently if I drink echinacea tea in my travels. But there are other things that are considered immune boosters. Hypothyroidism is not good for the brain. It can occur in 40% of those women who have FACS-TAS. We occasionally see it in men also, but it can start well before FACS-TAS, so getting your thyroid checked on a regular basis by your doctor is important. And then we already talked about depression and anxiety and treating that. Avoid toxins, avoid pesticides, insecticides, high mercury. You know, my husband liked to eat ahi tuna multiple times a week, and I said, boy, I think this has too much mercury. I got my mercury levels checked, and they were sky high. And then I asked my doctor, should I get chelated for high mercury? And he said, no, it'll just make your brain worse. He said, just stop eating ahi tuna. So my blood level went down, thank God. But, you know, that's the place where you get mercury, not in vaccines. You get mercury by eating swordfish or shark or ahi tuna or other fish that are high in mercury. We have had many individuals who have developed FACS-TAS symptoms after surgery and general anesthesia. And there is a big literature about anesthetic agents that are more toxic than others. Isoflurane and sevoflurane can be toxic to the CNS. Multiple general anesthesias, even in childhood, is associated with a lower IQ. Propofol, we wrote a review about anesthetic agents with a couple of anesthesiologists. Hopefully that'll get accepted and could be disseminated. But propofol is one anesthetic agent that seems to be the least toxic. It's not just in FACS-TAS patients, but individuals with a variety of different aging problems such as Parkinson's disease or just older age are much more sensitive to general anesthetic agents. So if you can avoid general anesthesia, it's a good idea to do so. Don't get a facelift. I don't think anybody needs a facelift. And, you know, elective surgery, if it can be done under a local or perhaps an IV infusion of Valium or Propofol, maybe that's a way to go. So talk to your anesthesiologist. Excessive levels of alcohol, smoking, opioids, even marijuana, and we'll have a broader discussion of marijuana, I'm sure, but smoking in general is not good for you. So if you are in a situation where you're stressed or you're not getting cognitive stimulation, you want to try to change that. You want to have a real active life, lots of social interactions. You know, there's different programs for cognitive training that are becoming more popular. There's ways to relax with meditation, mindfulness, meditation, biofeedback, a variety of ways to lower stress. Counseling or therapy can also help you with stress reduction techniques. We think biofeedback can be pretty helpful too, but there's just the beginning of research in these areas. The Palouse et al. 2004 paper has a lot of websites on it that you might find helpful. I think that may be my last slide, but I'm ready to answer questions. And Jane, just let me know if I should start on the questions that were given to me when you emailed them to me, or do you want me to answer other questions?
Well, let's start until some come in. I did have one come in that asked you to expand a little bit more on the back issues that premutation carriers can see.
Well, you know, it only comes through our, we have a study, our genotype-phenotype study, where I would say the majority of older premutation carriers have back pain, particularly pain in the upper area here. Many have had disc problems and have had spinal surgery. This is not uncommon in the general population. My husband and I have a lot of back issues. My husband loves his tilt table where he can tilt upside down and relieve the stress from his back, and he wants me to do it more often. But I think that some of the connective tissue problems, or the loose connective tissue, loose ligaments, could be additive to what we see in terms of spinal problems in premutation carriers. We haven't compared that to controls, but it's just my impression of an area that needs more research. And if in our medical culture, there's a lot of surgery performed, and in some of the back surgery, sometimes doing intensive physical therapy along with traction, maybe a tilt table, can decrease the symptoms of a protruding disc. And if you can get away without surgery, I would say that's the way to go with intensive medical therapy. Sometimes you can't avoid surgery, but some of the longer-term follow-up data shows that intensive physical therapy may be as good or better than back surgery. So if you can possibly avoid surgery, I would recommend that. But sometimes you can't, so I understand that too. And sometimes you have a disease or cancer or something else where you can't avoid surgery, and I think that's fine. I've had several individuals with the premutation that have had joint replacements and have had no problems with it. I think the older you are, the more likely you are to get some cognitive symptoms after general anesthesia or neurological problems after general anesthesia. But there may be other allelic variants or some other secondary gene effect that could relate to that issue, and it just needs more research. We definitely need more research on toxins and anesthesia in premutation carriers.
Could you talk a little bit about insomnia? I know that I get lots of questions about women really struggle with that, and how common is that, and maybe some strategies for addressing it?
Yeah, so we find insomnia to be present. I think it was in about 60% of premutation carriers. I think in a study we did about daughters of fathers with FACS-TAS, that was the primary complaint that premutation daughters had. And that can start at an early age. I think it relates, we know from other research that there can be a mild GABA deficit. So the GABA system is the inhibitory system that helps you with sleep. A lot of sleep agents are GABA agonists. I would say the majority of individuals where I ask about sleep who are carriers, they have sleep problems. Sometimes they have problems falling asleep, but more commonly they have problems waking up at night and not being able to go back to sleep at 1, 2, or 3 o'clock. Sometimes they're obsessing about worries. So sometimes it can be associated, sleep disturbances are also associated with depression and anxiety. Sometimes it can be alleviated by using an SSRI that can decrease anxiety and obsessive thinking. More commonly, it will need a sleep agent, Ambien, Lunesta. These are GABA agonists, they're benzodiazepines. There's a variety of them out, and different ones can work in different ways for people. Another sleep agent can be gabapentin, which can help with painful neuropathy, but it can also help with sleep. A number of individuals have seen that a component of marijuana called cannabidiol, or CBD, can help sleep. And this is a GABA agonist. It's not the psychotropic part of marijuana. It's not THC. But it's CBD. It's the non-psychotropic, one of the non-psychotropic cannabinoids. And in fact, I was just talking to a psychologist, a friend of mine, and she says that for her back pain, she started CBD Wonder Drops that I think are 35 units of CBD compared to 1 unit of THC. So this is a solution that she puts under the tongue, and it helps with chronic pain, and it can help with sleep disturbances. We would like to get a study going with one of the companies that makes a CBD agent for sleep problems, chronic pain, and anxiety in premutation carriers, and we hope to get funding sooner rather than later. Of course, in the states where marijuana is legal, including Colorado, most famously, but also California, you can go into a marijuana store and look at CBD tinctures or CBD oral, brownies or whatever, and see if that is helpful. But I do think that that can be helpful, CBD. We don't like smoking because smoking leads to enhanced oxidative stress, but some of the oral products we think are better. But it's definitely something that needs to be studied.
Okay, I mean that's so there was we did get a lot of questions about are there any as premutation carriers we're all a little concerned about getting fax tests. Are there any things that any signs that we might either test for or be aware of so that we can take action earlier? I mean, what should we, is there anything, other than doing all these things to take care of ourselves, are there any tests we should have? Are there any studies we should get in? What should we do?
So there's no biomarkers that you can do that will tell you will get fax tests for sure. We do notice that in some families there are multiple individuals with fax tests, and in other families there's nobody with fax tests, and that may be related to a combination of background gene effects together with the premutation, and that needs to be studied. And in fact, Stephanie Sherman and their team are looking at genomic studies, particularly in premutation carriers that don't have fax tests and are older compared to premutation carriers that do have fax tests. We are very interested in trying to delay the onset of fax tests with many of the interventions that we've talked about before. We're also very interested in using treatments that could help fax tests, and we just finished an open label study of allopregnanolone that we're writing up now. Allopregnanolone is a natural neurosteroid that's very high during pregnancy, and it stimulates neurogenesis. It's helpful in post-traumatic brain disease, and it's helpful for different types of epilepsy because it is a GABA agonist, but it also stimulates neurogenesis. And actually, in a couple of the patients, we saw improvements in the size of the hippocampus in different parts of the brain, and some had improved symptoms, others did not. And so we want to look in more detail at allopregnanolone and actually other agents that we think could be helpful. So I think in the next few years there will be many more studies about treatments that could improve some of the symptoms in fax tests, but stimulating neurogenesis with exercise and maybe SSRIs and antioxidants or other foods that could be helpful, I think is important. I would say that when we looked at the daughters of individuals with fax tests, we only saw 16% of the daughters that develop neurological symptoms. And oftentimes when the symptoms develop in women, they can be very mild and quite stable for a prolonged period of time. If they have Parkinson's disease or, say, a gene that predisposes you to Alzheimer's, like an ApoE4, then you might experience more significant cognitive decline, because I think there can be an additive effect of having more than one, neurodegenerative disorder. So we're continuing to do research on that, and NIH did fund us for continuing our genotype-phenotype study to follow individuals with FACS-TAZ every 2 years. Although now I worry that NIH may not have funding that will come through with the new administration, but we shall see. But there definitely needs to be more research on all of these issues. So I think all the things that I mentioned could be helpful prophylactically. And then what really tells you in someone that has tremor, I do see a lot of individuals that have tremor, but when we do an MRI, we don't see any white matter disease or any brain atrophy, particularly in women. And so I think besides the neurological exam, the MRI is a very telling tool to help us understand if you're experiencing brain atrophy or white matter disease. And then if you do have white matter disease that's typical of FACS-TAZ, then we think about all the things that we want to reverse that could, progress FACS-TAZ. For instance, some couples will drink a bottle of wine at night, and that's actually too much for your brain in aging. So we like to cut that down to one, maybe 1.5 glasses of wine, particularly if you have white matter disease in your brain. You stop smoking, you treat the sleep apnea, you treat the high blood pressure, you start exercising and start doing things that can help repair the brain.
Okay. One question we have is, I know that you mentioned Zoloft and Paxil to ease anxiety and depression. Are there any other medications, or are those two the best?
Well, the SSRIs, they include fluoxetine, fluvoxamine, sertraline. There's also SNRIs like Cymbalta, which is duloxetine, or Effexor, which is venlafaxine. I think probably all of those do stimulate neurogenesis. Cymbalta and Effexor, venlafaxine, and duloxetine can also help decrease pain symptoms like fibromyalgia and other sorts of chronic pain symptoms. I think that CBD is probably going to be pretty helpful for pain symptoms, and a lot of carriers have told me anecdotally, but I think we have to do a controlled trial to look at improvements with CBD, but I think it will be very helpful.
Okay. So are there any pain alternatives to opioids?
Guanfacine is one, Cymbalta is another, Effexor, acupuncture, Lyrica, and CBD. It's very easy to get addicted to opioids. Very easy. And it's often thought that, when you get addicted to opioids, it's not so good at relieving pain. And that's what keeps making you want to take more opioids and increase the dose. So, that is something that is becoming a big epidemic. And the ones that we've seen who are addicted to opioids, we found that there's a lot more progression of the white matter disease, so we don't think that's very good for you.
This summer I know that you mentioned tinnitus in some premutation carriers. Can you talk a little bit more about that?
So we think the premutation can have toxicity in the 8th nerve, which is important for hearing. So issues like hearing loss, tinnitus or ringing in your ears, Meniere's disease, but also episodes of vertigo. These are very common in premutation carriers. Doesn't mean you're going to get FACS-TAZ, it just means that your 8th nerve is a little bit is somewhat impacted, we think, by RNA toxicity.
So if I get blood work every year, what are some things that I should make sure that they include in the blood test?
Well, we have seen, anemias, and so I think getting a CBC to make sure you're not developing anemia or myelodysplasia. This is a problem because we know that there is more iron deposited in the brain of individuals with the premutation compared to age-matched controls. So usually the first thing that a physician will turn to with anemia is thinking about iron deficiency anemia, and sometimes that's the case, but iron is dysregulated in premutation carriers, particularly those with FAXTAS, and iron can be deposited in the brain. We haven't, we're in the process of studying that and how that relates to cognitive function, but we don't like individuals taking a lot of iron or taking any iron unless they are iron deficient or anemic. But there's one possibility that the bone marrow may be causing some of the anemia through a myelodysplasia-like mechanism, and this is just an area of research that we're looking at now. There's a variety of issues related to early aging, like short telomeres, that could lead to myelodysplasia. I think it's good to look at a CBC. Your doctor can feel your thyroid, but if it's easily palpable or it could be enlarged, then thyroid function studies, I think, are important. You definitely have to get your blood pressure checked at least once a year, if not a couple times a year. We have seen an increase in type 2 diabetes in individuals with FAXTAS, but it's very much weight related. So part of the issue is when you develop FAXTAS or have balance problems and your walking slows down or your ability to exercise slow down, then you gain weight. And then you can develop a metabolic syndrome or type 2 diabetes. And so if you're overweight, then you want your doctor checking a hemoglobin A1C and thinking about type 2 diabetes in you too. We found that this is very much weight related as it is in the general population. But of course, FAXTAS, many individuals with FAXTAS do gain weight. So we like you to keep up the exercise that you can do if you have developed FAXTAS, and oftentimes working with a physical therapist that can help with ataxia or balance issues is very important. And a physical therapist can develop an exercise regimen that you can do safely that won't increase your risk for falls. I know people don't like to exercise, but it's really so important for the brain. When you exercise, that improves mitochondrial function, and that improves your neuronal mitochondrial function, and that helps your cognitive processing and thinking. So if you're getting foggy thinking and not exercising, you need to develop an exercise regimen, either working with a trainer or a physical therapist, someone that can help you do that.
Well, you had mentioned, so exercise for the foggy thinking, and you mentioned, though, that you knew of or had some supplements you could recommend for foggy thinking.
Yeah, also, foggy thinking can also go along with depression or anxiety. We did a study of Effexor, venlafaxine. We found we didn't do a controlled trial, but in case reports, we found that Effexor can really help with processing information. We did a controlled trial of memantine and in FAXTAS, and actually memantine did not help the tremor or the ataxia, but it actually did help auditory processing, and the event-related potentials all improved significantly in those treated with memantine compared to controls. In older individuals who are having foggy thinking or mild cognitive problems, we think memantine can help. We've also seen it help anecdotally in individuals that have really severe migraine headaches. blocks glutamate toxicity. It can help with cognition in individuals, of course, with Alzheimer's disease, or at least stabilize cognitive deficits. But we've seen it help event-related potentials in individuals with FACS-TAS.
You know, one of the questions I get pretty frequently is, you know, so I get a lot of emails from women who are premutation carriers, and so, for example, let's say they have high blood pressure, and so their question to me is, do they need to treat their high blood pressure any differently, or because they're a premutation carrier?
Well, I think they need to treat it with high blood pressure medication, and they can talk to their doctor about what high blood pressure medication can be helpful. Oftentimes, a low dose of an antihypertensive can be very helpful, like lisinopril or a diuretic or something else, because premutation carriers, I think, are more vulnerable to negative brain effects from high blood pressure, just because of the vulnerability that I talked about with the neurons. And so I think that they need to be pretty careful. Like, I talked to one mother who said, you know, I've never been hypertensive. You know, I'm not hypertensive when I'm in my doctor's office, and we find her hypertensive on multiple occasions, and maybe we just make people extra nervous. But that kind of blood pressure I worry about, that is registered as being high on a regular basis.
Right. But you treat the high blood pressure. You don't treat the high blood pressure differently because you're a carrier. You treat
I'm more aggressive. I'm more aggressive.
More aggressive. I mean, you want to make sure we treat it because you are a carrier, but you don't do anything.
Because I think premutation carriers are more vulnerable to white matter disease that we know can be associated with high blood pressure. So somebody might say, oh, well, I'm just going to exercise more and therefore lower my blood pressure. Oftentimes that doesn't do it. Okay. I think oftentimes, and people are somewhat of avoidant of having medical interventions for high blood pressure, but I think it really can have a beneficial effect with aging.
So another question I see a lot is about women who especially go through either start into menopause earlier or develop FACS-POI, is their bones. Their bones deteriorate, osteopenia, osteoporosis. Any recommendations on that?
Oh, well, yeah. People should be treating that with a calcium, magnesium, vitamin D supplement and exercise. Now, you can talk to your doctor about other sorts of treatments for osteoporosis, like Fosamax or bisphenols or other sorts of agents that can slow down, break down a bone, but I think they can be very helpful. Usually there's a limited period of time that you can take Fosamax before other side effects can develop, but that should be discussed with your doctor. But I think this is really important because then you can break bones. And if you don't treat the osteoporosis or osteopenia, and particularly if you're elderly and you're having balance problems and you're osteoporotic, you're much more likely to break a hip. So you really need to jump on that treatment. And I think this is important. Some people, you know, depending on your risk for breast cancer, people might go on a low dose of hormones or say a birth control pill up until age 50 or so. And this is something that you can discuss with your doctor. But there are a variety of treatments out there, and even newer treatments that are long-acting treatments. And this definitely needs to be discussed with your doctor. I take Caltrate and vitamin D and glucosamine, chondroitin sulfate every day, twice a day, actually.
I do too. I do too.
Yeah, I think it's really important.
So the FACS-TAS, and you mentioned that you see some families who have lots of people with FACS-TAS, or lots of family members, other families not so much. So if my father had FACS-TAS, what's the chances that I will get it?
Well, in a paper that we published a few years ago, it was about 16% of daughters of men with FAXTAS develop FAXTAS themselves. And oftentimes when FAXTAS starts in the daughters, it can be far less severe. So many women have taken care of their dads who have had a terrible course of FAXTAS, and then they worry about developing it themselves. But if it did start in the 16% that it does start with, it's usually much, much more mild, unless there's other complicating factors, like Parkinson's disease or other factors. So, we need to do more studies about background gene effects. But if your father and all of his brothers had FAXTAS and so did their mother, then we worry a little bit more about you than if nobody in your family has FAXTAS.
Okay. So that's what, and because, so my dad did not have FAXTAS. I didn't see any early signs, but it's still, you still wonder about it.
Yeah, yeah, and I understand that, and that's why we're wanting to do more and more family studies and see what's going on.
I've got just a couple more questions. I know we're past the hour, but I know that I also hear that the sensory issues that some premutation carriers, they have, I think, some issues that are similar to our children that seems to worsen with age. Could you talk about that? Have you heard about that?
Yeah, absolutely. So I think that's related to a GABA deficit. So the GABA system is the inhibitory system. It's very much down in individuals with Fragile X syndrome. So they can't habituate to a lot of sensory stimuli. If you hear stimuli again and again, most of us, have less of a autonomic response or a sympathetic response to that. Usually in premutation carriers, it's a more subtle effect, although it can be more dramatic with aging, and it probably relates to a GABA deficit that may get worse with aging. There was a paper by Conti et al. That documented a mild GABA deficit in premutation carriers through an electrophysiological technique, and for some carriers that's worse than others. They might be more sensitive to sounds or smells or tactile stimuli, and that can get worse with age for some, but certainly not all. And most carriers don't have significant symptoms from that. But most carriers, I think, do have some degree of anxiety, whether it's something that registers as being an absolute anxiety disorder on a DSM-5 standardized issue, or whether they're just anxious periodically at times. Usually anxiety does get worse with age, and that also may relate to the GABA deficit. That's why we're interested in different types of medications besides SSRIs, like GABA agonists. Like some carriers take Xanax and say it works great. The problem with Xanax and some of the other benzodiazepines is it can sometimes cause sedation, and it can be addictive in that you have to have more and more of it over time. So if you can keep it at a low level and it doesn't cause sedation during the day, that can be helpful. But sometimes problems with driving, etc., can cause difficulties. That's why if someone is having significant anxiety, we like to get them on an SSRI, because that'll stimulate neurogenesis too and help them in other ways. And then for, say, an acute panic attack, Xanax or another benzodiazepine, might be helpful. So, there's different ways to treat anxiety. I really think that CBD is going to become a major player in treating anxiety and some of the sleep disturbances that carriers have. So none of these things, I think, are predictive or relate to FAXTAS. So I don't want anybody who's listening to this say, oh, I have anxiety, does that mean I'm going to get FAXTAS? Or even numbness or tingling in the extremities. That doesn't mean you're going to get FAXTAS either. So, many of the premutation symptoms or migraine headaches or sleep apnea doesn't mean you're going to get FACS-TAS. There's just a variety of problems that can happen with the premutation, including immune dysfunction, and that doesn't mean you're going to get FACS-TAS either. FACS-TAS is tremor, ataxia, and many other neurological symptoms combined with an MRI that shows some white matter disease or atrophy. That's FACS-TAS, and as we know more about some of the RNA toxicity, there could be some forms of RNA toxicity that may be playing in more when you cross the threshold of FACS-TAS. But these other symptoms don't mean that you're for sure going to get FACS-TAS.
There's a woman who takes Lyrica, and she has heard it's bad for her brain. Any comments on the drug Lyrica?
I think it can really help with pain control. I don't think it's bad for the brain.
All right. I think I have one more I'm going to ask you. So, many of these we've covered. Melatonin, use of melatonin.
I think melatonin's great. I think, it's a great antioxidant, definitely helps the brain in a Fragile X mouse. I think it has many good effects. If you're having a sleep disturbance, I think it's great for kids. And it's been shown to help brain function in Fragile X syndrome in the mouse model. I've seen many kids that have done better. Some adults melatonin can be very helpful. Other adults, sometimes when they say they take melatonin, they say they have sometimes worse problems or they don't tolerate it or bad dreams. I've heard different kinds of excuses, but it's certainly something that should be tried.
So we have a few more questions that we haven't answered. Most of them we have answered. I think, one thing that I would like to do is make sure that everyone's aware of the article that you wrote about premutation carriers that's on our website.
The Palouse et al. 2014
yes.
paper. Yeah, I think you should have
I'll send that one out.
Hagerman and Hagerman, Lancet Neurology, 2013, and then a more recent article on FACS-TAS is in Nature Neurology, 2016.
I will look all those up, and then we'll get all those sent out to everyone who we'll post it on the foundation website, our Facebook page, to make sure.
Also, Ann Wheeler and others have done good reviews about premutation involvement too.
Okay, I'll make sure I get a complete list of articles from you. I did receive a few questions about children with Fragile X and some issues there, or some genetic questions. I want people to feel free to email those to me, and I will get those answered in one way or another.
We didn't talk about the developmental problems that sometimes can occur in premutation carriers. I think that we first reported that even before we reported FACS-TAS, and nobody believed us that some premutation carriers, particularly boys, but sometimes girls too, can have some developmental problems like ADHD, shyness, social anxiety, sometimes social deficits. Here at the Mind Institute, sometimes if people come in with a diagnosis of autism, of course we always test for Fragile X, and oftentimes we come up with a premutation. And so we're probably skewed for more premutation carriers that present clinically that have autism, but it can be high. I think in the survey that Don Bailey did, it was about 20% or so that met autism, and that's probably what it is overall. Pretty similar to Danuta Loesch's study, between 10 and 20% of boys, particularly with the premutation. And we found that if you have seizures with the premutation, and about 11% do, with the premutation, that you're much more likely to have an autism spectrum disorder with the premutation, at least in our study of the boys. It happens less so with girls. But instead of seeing full autism, more commonly you see mild social deficits, that don't meet autism criteria, and it definitely could be related to the severity of the anxiety.
Okay. So what I'd like to do is take some of the questions that maybe we didn't get to, and I'll put, maybe I'll, would it be okay?
If you want to ask a few more, I'm okay until 6:30.
All right. I guess everyone heard that, didn't they? Let's see. There was one here. There's a couple. Well, my thing is jumping all around. Any link with Raynaud syndrome and being a premutation carrier?
Yeah, we do see more Raynaud's, so we always ask for it. It's part of the immune dysregulation. We've also seen Sjogren's syndrome, dry eyes, dry mouth, hypothyroidism, fibromyalgia. Some of this has more well-documented immune dysregulation than others. Ankylosing spondylitis, and that usually has an HLA genotype associated with it. But MS, lupus, these are things that we see not uncommonly. Rheumatoid arthritis or joint pain, arthritis in general. So I think the ones that really stand out, at least in our previous study, to be significantly different than controls was the hypothyroidism and fibromyalgia, and maybe one other. I think 1 or 2% will have MS, and we've continued to see ongoing premutation women with MS, about 1 or 2%. We have a few, I think 3 different papers in the literature about that. And one with MS and FACS-TAS, where both lesions of MS and FACS-TAS were seen together in the brain after she passed away. So, I think it's hard to get the MS neurologists interested in this association with the premutation. I've tried to get several more enthused about it. But we will continue to try to do that.
Does the exercise have to be a certain intensity, reach a certain heart rate, for example? And how much exercise should we be getting?
The amount of exercise hasn't been studied. It has been studied in other disorders like Alzheimer's. I would say at least an hour's worth of exercise a day.
And alternating between like lower intensity and high intensity, and aerobic and weight lifting, and just...
Yeah, I think the aerobic, something that gets your heart rate going, is probably the best for the brain. If you're a woman, who cares about the muscles?
So one person would like you to explain brain white matter disease.
So white matter disease shows up on MRI, and it is what we call a hyperintensity. If you look at it neuropathologically, it has kind of a spongiosis look to it, but it shows up on a flare and an MP range in MRI studies. The areas most typically seen with white matter disease are the middle cerebellar peduncles, and these are tracts going through the brainstem into the cerebellum and out, middle and superior cerebellar peduncles. You can see the white matter disease go into the dentate area in the cerebellum. in some patients with FACS-TAS. It can be periventricular white matter disease around the ventricles. It can be in the corpus callosum. Particularly, the corpus callosum is that band of white matter tracts that are going from one side of the brain to the other. And usually the splenium, the back part, and the genu can show white matter hyperintensities. And so these are areas of white matter disease. And then they can occur throughout the cortex. They can occur in spots or in the frontal part of the ventricles or in the inferior part of the ventricles. So these are areas of white matter disease. It usually means that neurons have died and the tracts become diseased where there might be holes in the tracts. And again, it looks spongiosis-like when you look at it neuropathologically. And these can be associated with FACS-TAS.
So, and I think I can find an article for this person with pictures to show what we mean by that matter disease. Mm-hmm. So does an ADHD medication have the same prophylactic impact as SSRIs?
No, it doesn't stimulate neurogenesis, ADHD meds. It helps you with attention and concentration. We usually don't use it in older people because it can exacerbate high blood pressure. And it's a little hard on the heart in older people. Mid-adulthood, it's fine. There's a lot of ADHD children that grow up to be very disoriented or disorganized in their work and will do better with a stimulant med. But it's not so good in aging.
So if I don't have severe anxiety or depression or almost non-existent, should I still take an SSRI?
That's a very good question. We don't have that answered. Would that stimulate neurogenesis? I would say if you don't have anxiety or depression, I would use exercise to stimulate neurogenesis. But if you are anxious or depressed, you can use an SSRI.
Okay. Can asthma be brought on by exercise related to pulmonary problems, related to being a carrier?
That's a very good question. We don't think that asthma in and of itself is associated with the premutation. There is an entity called exercise-induced asthma that occurs in those individuals who are asthmatic. Okay, yeah. Sorry. So exercise-induced asthma is a disorder that is associated in some people that have allergies, and usually using an inhaler before you exercise is the best way to treat that. Albuterol inhaler, there's a variety of different inhalers that you can get from your doctor.
So I know that, I think in your 2004 article, you do list the supplements that you recommend that people take. Is that you know, there's articles associated with the supplements. Most of those articles are not done in premutation carriers, however. This is what's known about supplements from the general population. For instance, in the studies about aging and risk for Alzheimer's disease, there's a lot of evidence that taking folate and B12, which lowers homocysteine, is helpful for brain aging. Some of this research was done in England, and so there's a body of literature that's very positive about that. That folate and B12 is helpful for the brain in aging because it lowers homocysteine, which is kind of like cholesterol in terms of causing more problems with the aging brain. So speaking of supplements, though, I know I think 2 people contact me that said that their bodies didn't really absorb some certain vitamins. Is that more individual, or have you seen that across premutation carriers?
I haven't done any absorption studies, but when you take mega amounts of vitamins, sometimes it's stooled out and not completely absorbed.
Okay. And one final question, what about GABA supplements?
So GABA supplements are not thought to stimulate the GABA system because it's broken down in the gut. But GABA agonists, like CBD, and of course benzodiazepines are GABA agonists too, but we're talking about GABA A agonists. Ganaxolone is actually a GABA A agonist that we've studied in Fragile X syndrome and was helpful to a certain extent for anxiety, but there will be other GABA A agonists that will be studied in the future and in premutation carriers. But just taking GABA itself is actually broken down in the intestines.
Okay, so where, if all of us premutation carriers want to do some studies or get involved in research, where should we go? What should we do?
Yeah, so there's studies going on in a lot of different places. Deb Hall in Chicago does a lot of studies in premutation women. She's also a FACS test expert. Dr. Todd in Michigan does FACS test studies. We do premutation studies at the Mind Institute. You know, I think there will be other centers that will be more involved. Stephanie Sherman is very interested in genomic studies, and in their Fragile X Center grant, they're doing genomic studies in FACS-TAS and also in seizures in those with Fragile X syndrome, and also in FACS-POI. And Stephanie has done many studies in FACS-POI in Wisconsin with Marcia Seltzer or Marcia Matlick. She's done studies in Fragile X families, including premutation moms. That's the center where Len Abadudo used to work at the Wasteman, but now we have Len Abadudo here at the Mind Institute. We're so lucky to have him. David Hessel and Susan Rivera here at the Mind Institute also have a TRACK study looking at men who don't have FACS-TAS in mid to late life and following them over time. Our genotype-phenotype study will begin to focus much more on those with FACS-TAS and following them every 2 years. So we'll be recruiting a lot this year. Hopefully, if you write your congressman and ask for more studies in premutation carriers, that may help, and that you should go to your Washington Day that the National Fragile X Foundation organized. It's very important now with the new administration. Trump and others need to know how important the premutation and Fragile X issues are in Washington. Now more than ever, we don't want to see funding cut to NIH or Department of Defense or CDC. So write your senators and congressmen.
With that, we'll come to an end. Do you have any final words you'd like to say? But I mean, those were good final words. I don't know if you can beat that.
Yeah. Well, I'm really excited about some of the new studies that can take place regarding to helping premutation carriers, because I think that there's so many treatment issues that need to be studied, but particularly treatments for anxiety, for sleep disturbances, for autoimmune disease, for FACS-TAS, and also for FACS-POI, preserving ovarian function. All of these are really important, and the premutation is so common in the general population that we really need to push for more treatment.
Great. So with that, Dr. Hagerman, I'd like to say thank you for sharing your amazing expertise with us. What a wonderful evening that you've
yeah, I hope I answered a lot of questions and hope I alleviated some anxieties and didn't cause more.
I think that's the case. I know I learn something every time I hear you speak. So we're so thankful to have you up here tonight.
Great.
I would like to let everyone know that we do have 3 more webinars scheduled. On Valentine's Day, we have a webinar with Mouse and Tracy. We are going to, this will be in the middle of the day. It's going to be noontime, Mountain Time. And then we will be doing another one February 16th with Vicki Sedhalter. She'll be discussing IEPs. That will be in the evening. And then I will, the end of March, I'm going to talk about housing for adults. And so, again, these webinars are provided by the National Fragile X Foundation for free, thanks to the support of our generous donors. You can continue these resources by giving to the foundation at donate.fragilex.org. I'd like to just say good night, everyone. It's been a real pleasure. But email me if you have any questions. It's jane@fragilex.org. I look forward to hearing from you. And Randi, thank you so much.
Yeah, my pleasure. See you guys. Bye-bye.
Good night.
Good night.
Good night.